Welcome back. Thanks for staying with us on the AM report. Now, Higher Health South Africa has raised the alarm that the fourth wave of COVID-19 infections could derail the start of the 2022 academic year. To save contact learning, a 30 to 70 split between in-person classes and online seems to be the preferred way forward for campuses. Higher Health SA CEO Professor Ramnik Aluwalia joins me now via video link from Cape Town for a forecast of the academic year ahead. Professor, very good morning to you. Thank you so much for joining us. The threat of the Omicron variant is something very real, as this powerful fourth wave could essentially take the education strides backwards. What's your take?
Thanks, Mfo, and good morning to everyone. Now, Mfo, the reality is that we are facing as a country a new mutant, a new Omicron, which is clearly showing that it's extremely highly transmissible. It has shown very high affinity to the youth. It spreads very quickly. And what is also coming out very clear, which the scientists have been discussing, is the role of vaccination in all this. And if you look at the vaccination rates, and currently also that the immunity that the vaccines produce, which is predominant T-cell immunity, eventually picks up so quickly that it overshadows the viral load. So when the virus enters the human body, it multiplies into a big viral load because it binds to the cell, and these new variants are binding capacity is becoming better. But on the other side, our vaccine immunity helps us to build an immune response very quickly. So when the immune response builds quickly and overshadows the viral load, your transmissibility of the virus also falls because your infections are either mild or moderate. And in that context of the science, the question about youth, because South Africa is a young country and higher education is a predominantly youthful system. And in that system, when there is congregation of young people, they're living together, they're residing together, they are in the classrooms together, the transmissibility goes far more quickly, which means cluster outbreaks happen. In fact, when we started the fourth wave, we saw a major cluster outbreak in one of our universities in Tshwane that led to the discovery even of the new variant, which clearly defines and understands how quickly it can spread among young people. So with keeping that context and knowing that our young people are not vaccinated at the stage we should have been, we are estimating only about 1/3 of our students either fully vaccinated or partially vaccinated at this stage. And we are hoping that the middle 1/3 that's showing, they're showing that they want to get vaccinated, they have mild hesitancy, they're engaging with us. And should we be able to get this in December, January period, if we reach about the 2/3 population vaccinated by January, then what will start happening is that our business continuity model, which has been a contact learning model. We remember universities were built in contact learning. And higher education is not just about universities. It's called TVET colleges. It's got community education colleges. And these were built on contact. You can't teach plumbing, mining, electrical, medicine, engineering completely remotely. So the shift has to be back to 70% contact learning and 30% online learning. And that hybrid mechanism needs to now move into, and that can only work should our population start getting vaccinated early.
In tabling some of the solutions that may work come 2022, let's go back a little bit on the conversation around mandatory vaccination. We know that as matters stand, no decision has been made in the education sector on vaccinations. And then it brings to mind some of the conversations and the criticism that we've heard behind the scenes on where some students are standing, some of them saying that they're not going to be forced into vaccination and that they will find other alternatives. What will happen then? Should the conversation move to the compulsory vaccination and some students refusing to get vaccinated?
As I speak to you from Cape Town, I'm here because I'm consulting another subsystem at this moment on the issue of regulatory vaccination in the TVET college system. And similarly, we've been speaking to almost every senates, councils of the universities, and universities have a parameter of understanding on when and how to impose, if the word called regulatory vaccination, we don't call it mandatory, but regulations around vaccination. The few universities that have taken the decision versus many universities that are still considering or engaging, there is a parameter for a decision making before a decision making is made. And that's a word called consultation. And in the consultation, we have advised every system in the institutions of higher learning is to look at a 360 view before a decision is made. When I say a 360 view, what I mean is there has to be a deep consultation process. But before that, we need to look at how is our vaccine program matured in that institution. Remember, in every university in South Africa, through higher health and the institution, we had built called the vaccination centers, which means vaccinations are available 24 hours, on working hours in the institution, and easy access for students. This process started from 1st of September when the president opened it under the 35 years of age. Many institutions we started early. In some institutions with only time we could build. And our system is very rooted in rural and peri-urban. In fact, if you ask me, 75% of our post-school system is in very rural and peri-urban areas. And it took time for the vaccine maturity program to reach to the students, which means institutions that have matured their vaccination program, they have tried every route of vaccine promotion, vaccine strategy of education, are now deeply in consultation to say, we are reaching this deadlock. We have a business continuity to happen. Vaccines can make it possible because there will be a challenge for them to mix vaccinated and non-vaccinated people in the same time, whether it's in the classrooms, whether in the residences. So they are now in the last phases of consultations. They are prone towards regulatory vaccination. Regulation is all about, as you say in the highway, when your car is driving and you can be at risk. That's why you put 120 kilometers or 60 or 80 on the speed of the road, predominantly because you can be on the risk for yourself or to the others. And that is exactly what the institutions find themselves of saying what kind of regulations and at what stage can they put. So yes, as a sector, we haven't decided yet on mandatory vaccination yet. But what we are doing is with every system in every area, we are looking at various parameters and saying, should we reach a deadlock where we're not getting our students to get vaccinated? We're trying all our vaccine promotion and vaccine strategy, but it's not working. Then this remains the last alternative. And this has to be done should our business continuity, which is graduate competencies, the private sector demands that the skills needs to be built. The country's national economic system needs skills building. And that depends on higher education, and that needs contact understanding. And that's where we are and we find ourselves in.
The Student Union of South Africa has reacted and said that they feel excluded from some of the conversations within these meetings, that the conversations don't include them because they're not thoroughly engaged. As a result, the forecasts and anticipation come 2022 is that this may ruffle feathers and lead to protests, which will delay the academic period, the academic time, which higher education does not want to lose. What are the higher level talks that should be underway in ensuring that students are thoroughly engaged and that there's a level of understanding to avoid contention come 2022?
I just wanted to inform you that Higher Health has done a series of consultations with the student representative councils in SAULS in Satwetsa, quite even one and a half months earlier even to what we're speaking, because we could foresee this incoming. And one thing I want to assure you is that every SRC president that I have met and the South believes in vaccination. They believe that vaccination is the way forward. What they are really emphasizing, which they are correct in emphasizing, is that we must be able to give more time towards vaccine maturity project, towards more vaccine promotion, vaccine strategies. We've actually done joint campaigns with them where we are bringing vaccines on routine basis on campuses through a campaign and trying to make it more youth-friendly and peer-to-peer influence. And they are a big peer influence at the end of the day. So the aim will be is that we are engaging with each other. In fact, I'm going to be going into a meeting later with them in the similar situation of saying, how do we plan? Now we are sitting on 10th of December. We wanted to achieve this target. We have not achieved the targets we done. We are going into recess. Now, what's the strategies we'll put from 10th of December to say 15th of January when they start coming back into the campuses, and say how we make and through social media, through your platforms, we are appealing to our student community, to the parents, to say if you are at home, you find your nearest vaccination center. We're trying to clear all their myths and challenges, and we fully respect what the youth goes through at this difficult time, and see if we can reach close to our 2/3 population, say by end of January. And how do we kickstart the next 15 days with an aggressive program? But there will be a time if we start losing out our targets, we're not reaching. And that's a discussion when higher health, South, department, institutions start sitting on the table and start engaging to say, now what is our options left? And that is the time mandatory vaccination or regulatory vaccination starts coming. You must also remember, we're also looking at a phased approach of regulation, not a complete one fit all for everything.
Yes.
We're looking at where the regulations will be more necessary. For example, health science students. Remember, these students have to go to the hospitals and they can carry the virus to the most vulnerable, that is the patients. Mm-hmm. So we have to be extremely concerning. And as a medical doctor during my medical school days, we were given more vaccines than a normal population because of our own exposure to risk to those diseases.
Professor, we're going to have to leave our discussion there. Thank you so much for engaging us and speaking to us there. Higher Health SA CEO, Professor Ramik Aluwalia, speaking to us there about some of the measures that are in place and discussions that are underway when it comes to ensuring a smooth start to the 2022 academic year as far as higher education is concerned. Let's now remind you of some of the big stories we're tracking for you this morning. South Africa